I had to advocate for myself a lot to the point of saying, hey, I'm going to leave this hospital and find care elsewhere in the middle of labor.
And I know a lot of other mothers not wanting to go to hospitals because they just know how quick that power can be taken from them.
Why are Black women more than 3 times more likely to die from pregnancy-related complications? Why have the numbers gotten worse? What can be done to improve outcomes? Like many researchers in the maternal health space, Towson University professor Tosin Adebayo is trying to answer those questions.
This is not a new issue. This is not a new problem. We've talked about, maternal mortality among the Black race for years, for decades. Every other racial group has a decrease, but Black women.
It was Tosin's own experience giving birth to 3 daughters that led her to start the research.
Reading all these scary things about Black women dying and passing away from pregnancies, like, oh my God, I'm in the demographic. Is this going to happen to me? And that was the beginning of my interest.
Her research boils down to communication, or the lack thereof, how the quality of healthcare is shaped by how patients and providers interact.
What am I hearing? How am I making sense of what my provider is telling me? Do I feel safe enough to talk to my provider?
She says the burden is often placed on Black women to have to advocate for themselves.
Unfortunately, it is a real skill that you have to develop, because sometimes you are not listened to. There are several discourses and perceptions about you that have gone ahead of you in the healthcare system that you're not even aware of.
She adds that the problem is multifaceted: racial discrimination, microaggressions.
We have social determinants of health. We have like issues of education, where you live.
There's a long history of mistrust for the medical system, but also just the feeling of not being comfortable.
There's ample research to tell us that African American women are more comfortable, or even Blacks in general, with healthcare providers who are of the same race as them. They understand their history, they understand their perspective.
As part of her research, she would go into prenatal appointments to observe interactions.
I was actually in the delivery room with this woman, and she just wanted me to observe what was happening. And at some point, she needed someone to speak up for her.
But Tosin knows she won't always be in those rooms to advocate for other Black women. Still, she hopes her research will help move the needle.
We are not talking to one another. 80% of maternal mortality cases are preventable. There are things that could have been caught early on, but how are we coming together to create a layered approach to solving the problem of Black maternal mortality?
Cara Burnett, WMAR2 News.